This way. All right, my name is Natalie Tetrick, and this is our Unit 4 Case Connections assignment. So I chose to work on case number 2 and 3. So in case number 2, we have a child who presented with PKU, phenylketonuria. And so a little background on PKU, it is due to the lack of phenylalanine hydroxylase. And what that does is it turns phenylalanine into tyrosine. Tyrosine is an amino acid that is synthesized from phenylalanine. It is not typically essential, meaning we don't need to consume that into our diets. But in the case of this child with PKU, she will need to consume phenylalanine in her diet. Or tyrosine in her diet, rather. We find phenylalanine in protein-rich foods. And so if we don't have the phenylalanine hydroxylase that turns the phenylalanine to tyrosine, then our levels rise in our body. And that can be really toxic. So our body has this great mechanism for preventing phenylalanine level rising, and that is a conversion to tyrosine. That's a really essential mechanism that our body has because of how toxic phenylalanine can be. So increased levels can cause trauma to the central nervous system and to the brain. Some symptoms of PKU actually include like failure to thrive symptoms. And the child's parents said that it did not run in the family. However, PKU is an inherited gene. So it was in the family. They just maybe didn't know about it, or both parents were like recessive carriers or something like that. And so then we go on to this graph. And on this graph, we see that patient B was administered BH4. And so patient A has an excess of phenylalanine in the blood. That's what that shows us. And patient B, based on that graph, she does not. And so this lets us know that she is actually deficient in BH4. Patient A is not deficient in BH4, our primary patient. Her levels are fine. And so some dietary treatments that can be instilled that it looks like the physician had already started instilling for that child was only obtaining the amounts of phenylalanine necessary by the body. So limiting your dietary phenylalanine intake in order to prevent that buildup. That can cause, like we discussed earlier, the CNS signs and everything like that. And so, but that also means that this patient will need to include tyrosine in her diet. It will not be able to be synthesized by the body anymore. It is essential that this patient consumes that. Okay, so that kind of concludes case 2. Now moving on to case 3, we have the man with gout. And we just recently found out that he drinks 5 liters of soda a day, because he was told that real sugar is better than artificial sugar, which potential, but all that soda is bad for you in general. And so history on gout. Gout develops when monosodium urate gets deposited in the tissues. It's in excess. So then your serum uric acid concentrations will increase, and then that forms crystals. And so based on all of our choices, we can conclude that choice 3, the decreased urinary excretion of uric acid, is the patient's cause of gout. We also know that 90% of gout cases are caused from that, as cited in my citation. But then looking at choices 1 and 2. So choice 1, overproduction of purines, and choice 2, decreased salvage of purines. So with the overproduction of purines, we would need a little more information on that. That is typically from a malignancy of some sort, and we do not have any evidence to support that. In order to see if choices 1 and 2 are maybe contributing to this man's gout, we really need to have a little more information. But based on what we do have, we can conclude that the cause of his gout is due to the decreased excretion of uric acid in his urine. So about high fructose corn syrup, we know that can elevate uric acid levels. And some research has come out saying that vitamin C increases the excretion of uric acid. So a long-term solution for this patient number one would probably be to stop the soda intake. That is not helping him at all. And even if he did not have gout, that much soda did not help him. But switching to vitamin C rich foods, drinking enough water, those are all things that would be really beneficial for him. So yeah, overall we know that choice 3 is leading to his gout, and that he should stop the high fructose corn syrup drinks because they elevate uric acid levels. And if he is having issues excreting, or if his body is not excreting enough uric acid in his urine, then he's bound to get gout, especially with how much high fructose corn syrup he's ingesting. So thank you. That was my Unit 4 case pathway presentation.